One day about 15 years ago, I got a phone call on my day off from a friend of mine who was a dentist. And he told me that he was in the hospital with a mutual patient of ours who had tried to commit suicide and by overdosing herself with medication, and that the hospital didn't really know what to do with her. She was in extreme pain, extremely agitated. They had her hook up with IVs, and that her vital signs were extremely erratic. So he said, would you mind coming to the hospital and take a look at her? That day I got special permission to actually treat a patient in the hospital in Natick, Leonard Morse Hospital. And I went in and I walked in, and there was this patient lying on the bed, and when I looked up at the monitors, her vital signs were extremely aberrant. Her heart rate had been around 120. Her blood pressure was 200 over about 135, 140, and her respiratory rate was actually double normal, around 32. The problem was that they had just pumped her stomach because she had tried to over-medicate herself, so they didn't have any medication that they were able to give her, and they were afraid that she might either stroke out or cause more damage because of her erratic vital signs. So my friend, the dentist, asked me if I would mind trying to adjust her. So the nurses came in and unhooked her IVs, and I evaluated her and determined that she was subluxated in her upper cervical spine, and she also had some other issues going on. And while she was still in the bed in that position, I decided to make an adjustment. And I adjusted her spine, and we backed off, and they hooked up her IVs, and we stood there and watched and waited. And what was amazing was in the first minute, her vital signs started to drop down. And by the end of 2 minutes, her vital signs had all normalized. Her blood pressure had dropped to about 115 over 75. Her heart rate had actually dropped to around 70, and her respiratory rate had dropped to around 16. We stayed there for about an hour. Her vital signs stayed normal, and they set her up for some counseling. They never had to give her any medication, and within the next day, she was actually released from the hospital, pain-free, all her vitals were normal, and never had to do any medication again. And we had followed her up over the next several months of care, and she continued to progress and improve from that day forward.